I am a cosmetic doctor and have been working in the private sector for nearly 7 years. I've been completely out of the NHS for 4 years, but trained and worked in the NHS for the first few years of my career. And here's my take on the junior doctor strikes. Not the politics, just the pay and the reality. As of late December 2025, a 5-day strike had just finished and talks with the Health Secretary are set to resume. The main issues remain pay restoration and an effective plan to increase the amount of training posts available to doctors. The big question that everyone wants the answer to is, are doctors paid enough? I'll use a real-life example of one of my colleagues, a senior plastic surgeon, still classified as a resident doctor. Alongside his normal working duties, he spends 1 full day per week cutting cancers out of people's bodies. He would typically operate on around 3 to 7 patients during theatre time. We calculated that he's being paid £33 an hour before tax and around £24 an hour after tax. Not a bad wage, but think about what he's actually doing. He's removing cancer from someone's body, and a lot of the time saving their life and allowing them to live for another 5, 10, 15, 20 years. Even if his pay was doubled to £66 an hour, I still don't think he's being paid appropriately for the work he's carrying out. I won't get into the practical elements of how the government would do this, but I do not agree with anyone who says that doctors are being paid enough or appropriately for the work they are carrying out. People also don't factor in the journey that it takes to become a doctor. 5 to 6 years of medical school, 2 to 3 years working as a junior doctor, and then specialist training which can last 5 to 8 years. It's not just a long career route, it's very difficult and very expensive. Most doctors leave university with around £90,000 in debt. The strange paradox we're seeing at the moment, and the main reason I'm even making this video, is that patients are struggling to get appointments, but highly skilled doctors are struggling to find jobs. There is an issue with supply and there is an issue with demand. And this is only occurring because the government is not funding enough training posts. We can argue about whether doctors are being paid appropriately, but when doctors are unemployed or cannot obtain training positions while patients are waiting months and sometimes years to see a specialist, something is broken and it needs to be fixed quickly. Do I love the idea of strikes? No. Somewhere along the line, patient care is affected due to the strikes. But when pay is significantly less than what is fair, rotas are stretched and training posts are unobtainable, industrial action becomes the only lever on the table. So I don't blame doctors for striking. Doctors, including myself, have left the NHS in record numbers, and something needs to change, or we might not have an NHS in the next few years. So are doctors striking because they're greedy and they want to be rich? No. They're asking for pay that is appropriate to the high stakes work that they carry out, a training system that actually trains them, and care for patients that is effective and timely.